Good morning. This is Faith in Our Hometown, brought to you as a community service and sponsored by Mercy Hospital, Joplin. And now, here's your host, Father Jay Friedel.
Good morning, everyone, and welcome to another Sunday morning of Faith in Our Hometown, our weekly conversation with each other as members of this greater Joplin community and as members of people of faith. Today we're going to be talking about how to take care of ourselves a little bit and how to take care of each other in the midst of this mess in this time of pandemic, or this time of plague, as I lovingly refer to it. But a lot of people are struggling. A lot of people are finding it very frustrating to be separated from each other, and even with a little bit of a measured kind of rollout to kind of get things moving again, we still got a lot of people who it's better off for them to stay at home and to stay away from other folks, especially if they're elderly or immunocompromised or whatever. And it's frustrating for everybody, and there's still an anxiety level over those things of, will I get it? Will I get sick? If I get it, will I get it bad? What is it going to be? And so today I've got a licensed psychologist, Dale Wilkinson, who works for Ozark Center here in Joplin, and he's going to be here to talk to us about how we might cope during these times of pandemic. So we're going to be right back after this Mercy Minute. Don't go away.
The whole purpose of screening is to catch people who have a significant smoking history early enough where we can do something about it and potentially improve the duration of life. The minimum recommendation for screening is 30-pack years. So usually people who've smoked more than 30-pack years are the ones that we're screening. If we start screening yearly with low-dose CT scans, we can reduce the risk of death from lung cancer by 20 to 25%. Stage 1, 2, and 3 cancers potentially can be cured. When it becomes stage 4, the possibility of cure falls significantly.
So again, thanks for joining us for this Sunday morning on Faith in Our Hometown. My guest this morning, Dale Wilkinson. Welcome, Dale. Dale is a licensed psychologist, works for the Ozark Center here in Joplin. So Dale, tell us a little bit about yourself, and then let's talk about how we can help ourselves and help each other during this time of pandemic.
Okay. I am a licensed psychologist. I've been doing this for a while, 32 years actually. Been here in Joplin for 6 years, been working for the Ozark Center. So I've done a lot of different things with mental health in my past, public schools, inpatient substance abuse. I was the Department of Corrections for 8 years, taught college, private practice, and now I'm just doing outpatient psychology work. So I'm down here, hopefully at my last job in my retirement years. So.
Well, you know, Joplin is a nice community. I mean,
beautiful community.
Yeah. Mm-hmm.
Yeah.
So how do we help each other during this time? I mean, you know, people are frustrated, they're anxious, there are all kinds of things. Sure. What are you seeing out there, and what do we maybe need to, you know, what can we offer for our viewers to maybe help?
Okay. Well, we have, this is a crazy experience. We're not used to it. We're not used to being distanced like this.
Exactly.
Restaurants are closed, shops are closed. You can't just go to the store and buy a pair of pant slacks. You can't go sit in a restaurant and drink a cup of coffee with a friend. So, and then so many of us are at home. And then how do you deal with that? You know, there's several things that are happening. One is it's kind of a sense of grief. We're grieving our relationships with everybody. We can't can't go see our grandparents or our parents maybe because of this. We don't want to expose them. We have family members in the nursing homes and such. We might eventually be able to do a drive-by and talk to them through the patio glass and say hi, or do a tablet and do a face, you know, talk to each other. Mm-hmm. That's a learning curve for all of us. Learning how to do that.
Because it's not that the relationships have suddenly dried up and gone away, but we got to find a different way of engaging them.
Sure. So a lot more maybe phone calls, brief contacts. Make sure we're taking care of our diet and eating right, still exercising, getting outside, enjoying the sunshine, getting our vitamin D from that. So
I have to say, I actually have had more time to walk. And I've been working out more days, by being out on the trail and things like that than I have before this kind of mess started.
Yes, and you can
so
do
it's just
that
like,
and still stay social distance.
Yep, and in that sense, sometimes I will, meet one of my associates out there, and we'll walk the trail, or we'll do our thing, or or talking about the show with our producer Riley, and we can do those things because we can still walk the trail and still stay 6 feet apart.
Yeah, this weekend I took my son golfing, and so we're 6 feet apart at least during that, because we're 2 different areas of the fairway, if we're in the fairway. and then we went fishing, so we're on a creek, and so we can visit and still talk, and still communicate with each other. So there's ways to stay in contact. Joplin is an amazing town because we're a town of survivors.
Right.
We had the terrible tornado, and Joplin has survived and thrived through that. And this is a new kind of a trauma. Some of the things that are happening with folks are difficulty. Some folks are coping with drinking more or smoking more. Some folks are having more family arguments. Some folks are having more mood swings, anxiety or depression. Some folks are, they've lost their job, or they're not working right now, so they don't know what to do with themselves. So,
is it fair to say, do you think, that anything that was kind of a little bit on the edge before the pandemic hit, the pandemic is certainly that helped, but usually has exacerbated or made that worse?
Sure, it's just another irritant, one more straw on the camel's back, maybe.
Right.
And
that's what I found at the time of the tornado, as well as now.
Yes.
Anything that was just kind of like, just not working very well, now it's working probably a little bit less, a little bit worse.
Right. Yeah.
Yeah.
So typically I work with people who have anxiety, depression, grief, PTSD, emotional deregulation, where they can't manage their emotions very well. So then you will learn skills of how to manage that. With depression, it's typically getting more active, either socially. What I would dream that would happen again is that we start writing again. We don't write letters very often any longer. But letters are beautiful. But we do text, so that's a way of communicating. It's a way of writing. We can text each other so that we stay in contact. Remember to send cards to your loved ones. Remember to text birthdays and anniversaries, and just to let everybody know that you love it, that they're loved and that they're important.
Mm-hmm.
And that with our friends, one of the greatest things that you can do if you're feeling depressed or left out or alone, is to do an anonymous good deed for someone. It can be tiny. Nobody knows, they don't know, so do something to generate that within yourself.
Put a flower on somebody's porch.
Sure. Throw their newspaper from the street up to the porch.
Drop a cupcake by, or do something.
See their mailbox hanging open, close it as you walk past. It doesn't have to be anything large. So pick up their dog poop in the yard.
Once in a while.
I walk dogs.
Every once in a while we'll brush some off the trail that somebody left there as a gift for everyone. We'll brush that off the trail so that
protect everyone.
Somebody doesn't have to step in that. So
anonymous good deed. So for depression, it's mostly getting busy, I think.
Okay, which is a great piece of advice for somebody who's feeling a little blue or depressed.
Yeah.
Get out of yourself a little bit more and maybe just engage a little.
Do something for someone else, right?
Yeah. Mm-hmm.
Yeah. So for anxiety, it's a little different. Then we need to calm down and breathe. Different techniques for that. Used to always just deep breathe, teach people how to deep breathe and calm down. And relax yourself, slow your heart rate down. There's a technique everybody could look up if they want to, called the autogenic response. And I used that one time during a medical procedure to show the doctor how healthy I was, and got a great big crazy diagnosis, and lost my insurance for a while. It was back when you couldn't have pre-existing conditions.
Wow.
And so it took me a long time to convince them I did that on purpose. but slowed my heart rate down to 36 during an EKG. That's not a good thing to do. So,
Yeah.
yeah, but it was through that of being able to calm myself. Now I do it as a party trick at church.
Oh, well,
yeah,
there
during
you
the
go.
Lord's Prayer, I warm my hands, and then everybody wipes their hands after the Lord's Prayer. And I apologize, that I'm doing a party trick during the Lord's Prayer. But
Well, it's a good thing I'm not your pastor. But at any rate, it's interesting. That whole thing about breathing. I mean, we've got some great, and certainly in many of the world traditions of prayer, that whole idea of centering prayer or breathing prayer, breath prayer. I put one of those little things on my our church website the other day because for some people, because they were saying that they were anxious and they wanted to learn how to pray. So I, breathe in with one phrase and then breathe out with the next, and then breathe in with the one phrase and then out with the next. And
Beautiful.
You can use scriptural things. In God, who is my source of strength, breathe in. I have strength enough for everything. Breathe out.
Yes.
God, who is my source of strength, I have strength enough for everything. Okay. Or nothing will separate me from the love of God. Nothing will separate me from the love of God.
Yes.
But to do some of those things. And I say for some people, it's hard to do it for a minute, but if you can actually increase it up to about 5,
it's an amazing.
it'll really have some nice changes for you. It'll give you a kind of a new lease, of being a little bit, I think, calmer when you get finished, which is great.
Yes, it is.
Yeah.
Yes. One that I teach now is called breath yoga, and it's breathing. Some people call it breathing in a box. So it's to the count of 4. So you breathe to the count of 4, hold it to the count of 4, exhale to the count of 4, hold it to the count of 4, and then back in to the count of 4. And if you do that for 2 minutes, something about the pauses are so powerful. Music is nothing if we didn't have pauses and spaces.
Yeah.
And so that makes this breathing technique even more powerful, and then also protects you from hyperventilating. So
do that one more time, just for everybody. If everybody's looking for a little, party trick for their own living room.
So I'll even draw the box. So breathe into the count of 4, hold to the count of 4, exhale to the count of 4, hold to the count of 4, and then repeat. And do it for 2 minutes. Slower as you go because it'll get more comfortable. First few times you might do it, holding it to the count of 4 may be difficult, but as you get into the rhythm, it's extremely calming.
Yeah.
So.
Good. It's good for anxiety. Well, my guest this morning is Dr. Dale Wilkinson, who works for Ozark Center. We're talking a little bit about how do we take care of ourselves and maybe take care of each other in this time of pandemic. So we're going to take a quick break, and then we're going to be back to talk a little bit more about exactly that. So stick with us, and we'll be right back.
You're watching Faith in Our Hometown on KSN TV, brought to you as a community service and sponsored by Mercy Hospital, Joplin.
So this morning we're talking with our clinical psychologist friend, Dr. Dale Wilkinson, and we're just kind of talking a little bit about how we can help each other during this time of stress, time of anxiety. We talked a little bit about how to deal with depression. We talked a little bit about how to deal with anxiety. What else you got on your list is just kind of those big ones for right now.
Okay, and just for clarification, I'm not a doctor.
Oh, you're not a doctor.
I'm not a
That's
doctor.
right.
I'm a licensed psychologist, but not a doctor.
Sorry about that.
No, that's okay. You promoted me. Maybe I'll get a raise.
Well, maybe.
Yes.
Talk to those people at the Ozark Center. That's good.
So with our depression and anxiety, those are some hints that we had with it. The other things, this is causing a new sense of trauma and such with us. One of the things that is very interesting is springtime is coming, and we're getting ready to have our storms, and we always have some people with some residual anxiety from the storms and such. And then, so how do we manage that on a comfortable basis in a different way than we're used to, because we don't have the support, face-to-face support groups with people who we contacted in the past. Maybe we used to go to the coffee shop. Maybe we used to, visit face-to-face, We still can, but now we just have to be able to keep the social distancing. So things can still be the same but different, I think.
Yeah, just give them a twist rather than abandon them.
Right, we don't have to abandon any of what worked, but what can we do to make it work now with the distancing that we have? And again, I think it's some of the same thing. We had Easter dinner, my wife and I did, with 5 other couples at our own table during a Zoom meeting.
There you go.
I am not extremely computer literate, so it was a new experience for me, but it worked well. We felt like we were at a table with others,
Yeah.
So.
And I always laugh, because sometimes I'm going to say this, and it's going to seem like but some people sometimes get confused. It's just like, well, does that mean that we have to stay away from each other in the house? Well, no. I mean, you're sleeping in the same bed, you're doing your thing, so you guys don't have to distance from each other, those of you in that house, but the other households should be distanced.
Yes.
So that we've got, again, some space and some distance between us if somebody were to get sick.
That's correct.
Yeah.
That's correct. So the new piece of this, I think, is again, how do we make it manage? And I happen to be very lucky. I live in a neighborhood where so many people are walking. And so you walk, you can't go outside without somebody driving by and waving at you, So very nice neighborhood to live in, So that's all, we can still do all of those kind of contact with human beings. We do not make good hermits. Human beings, there aren't very many happy hermits,
There's a certain call.
So, yes.
Certain call, and most people aren't called to it.
Most people are not, yes.
Yeah.
And so you were mentioning earlier contemplative, you said centering prayer and contemplative prayer. It's a real powerful piece, of quiet prayer. You're well familiar with one that's a centering prayer of the Rosary. It's a centering prayer. It's like a mantra almost.
A lot of people misunderstand that prayer, but for us it really is kind of a mantra. It's in the repetition of the prayer. It's not that the repetition of the words does anything, but it just calms us down.
Yeah.
And how I always use that example, especially like at funerals or whatever, when we're praying for folks, and you start the prayer and everybody starts doing it together, and pretty soon everybody's breathing together and their heartbeats are in rhythm, and everybody just gets calmer and feels, more. It's just kind of like it unruffles everything, and just kind of like calms everybody down and puts everybody in it together.
A new level of community, yes.
Yeah. Yep.
Yeah.
Interesting.
So.
Yeah. So that's some of the anxiety. That's some of the depression. That's some of even the PTSD. How to do some of those
trauma,
things.
How do you manage with the trauma?
Trauma.
And then people still are needing therapy. So then how do you get therapy in today's world where you can't sit face to face to each other? And so most of the therapists in town are doing some type of telecommunication with their people. They have some type of a format on their computer or their smartphones where they can talk to each other, and it's still confidential. There's and it's a wonderful way to do therapy. That is
actually
different.
had a guest on I guess a few weeks before the pandemic started.
Okay.
And he was having some luck reaching out into doing some of that therapeutically. Yeah. I guess I hadn't thought about that. Everybody's kind of shifted during this whole time to where everybody's doing a whole lot of distance therapy. At the same time, since they can't be in the same rooms together. Yeah,
one of my clients is an over-the-road truck driver. He just took a job where he's going to be out of the state, and so I told him, well, we can't have our communication, we can't have sessions unless you're home, because I can't do a session with him when he's in Iowa because I'm not licensed in Iowa.
Isn't that something? I now see all the things I never thought of before, but yeah.
So, but if he's back home, then we can have our session through the telecommunication. But in our area, we're so rural, some people don't have good reception.
Right.
So then it can be done through the telephone. It's a little less personal, not being able to see face to face, but it's still the word that we can still hear each other. And then there's also services of texting services for a person can text in crisis, different places, and text anonymously, and at least be heard in that fashion if anyone was in a crisis.
So how do we, so that's the way that sometimes the caregiving professionals will take care, and some of the coaching that they do is to how to do some of those things.
Sure.
How do we take care of each other during this time?
Okay.
I mean, how do we do some of that?
I think maybe just take those cues and do it the same way as with each other. We're sending my father-in-law an iPad so that he's in a nursing home and he can't visit anybody, and the nurses have promised they will help teach him how to use it.
Good.
So then he'll be able to communicate. We
FaceTime
tried it out.
with you or do whatever.
FaceTime with him. We did it a couple weeks ago, and he got a pretty big kick out of it. So maybe he'll do it. I think the key is just to remember that we are not alone, and because we're not alone, then it's our responsibility to reach out to each other and to try to be there for our neighbors and loved ones and our friends.
Yeah. And that's very human. I mean, that's not necessarily fixing somebody or making somebody your project, but it's just the matter of human relationship and how you do that with each other.
And I think that's where mental health rests, is in human relationship.
Yeah. Well, that's where I certainly see that, your practice and my practice, kind of have got some similar ways of doing things. And again, that's been the real challenge for many ministers out there who really want to be with their people and have not been able to do that the same way that we were prior to some of this shutdown. How do we work more effectively to do it from the distance? It's not what any of us would choose.
No.
But we want to still keep the relationship strong enough that we can still do all the things that we still need to do for people, but not put anybody in danger or cause more illness.
Yes. Yeah.
And that's tricky sometimes.
Yeah. A little bit of sacrifice on our part to protect somebody else and maybe save their life.
Yeah.
Yeah.
Yeah. Mm-hmm. Words of advice what are some of your most sage little kernels that you save up for a moment like this? When I say, okay, here's your moment now to do mass therapy with a whole bunch of people out there in TV land all at once.
Yes.
Give us your best shot, your best kernels.
Okay. All right. Well, oh Lord.
So I put you on the spot to say fix the world. Okay. All right. Well, maybe not your best kernels, but throw me a few anyway.
I think to remember to take care of yourself, to take care of your diet, to eat right, to make sure you tell your loved ones they're loved, to stay in contact with all of your friends, and to recreate and have fun, even though we have to do it differently. If we can smile during the day, if we can smile, then we affect somebody else. If somebody cuts you off in traffic, instead of giving them a salute, wave at them and give them a pardon.
Different salute, a better
salute. Yes,
yeah.
Pardon, and if you ever do that to somebody, then they're always shocked.
Well, I'll bless people, and sometimes I think they wonder what I'm doing, because sometimes I'll just be like, God love you, it's all good, it's all good. And sometimes they look at me like, what did you just do to me? Did you just, and I was like, no, it was all good. It was all good. God bless you,
Yes.
But just even the wave, I agree, it's not a bad way to go.
A wave or a smile or a nod or, and we can still say hi to each other. We're not shaking hands any longer. But we can say hi with our eyes, with our hand wave, saying hello, and just that human touch, I think, is key to anything that we want to try to do.
I'm going to tell a little story on Father Paco here. Father Paco is my associate over at Sacred Heart.
Yes.
And Paco is funny because we're out on the trail together. Of course, we're distanced. We're 6 feet apart from each other. But I always get a big kick out of Paco because he always wants to make sure that he engages with whoever's coming down the trail toward him. And I get a big kick out of it because from time to time, he always takes this as a little bit of a challenge. Can I get this person to actually engage? And then I get a big kick out of it because sometimes he gets almost offended when they won't. So I always tease him and I'll say, but I said, you don't give up. Don't give up. This is a good thing. It's a good way of you being able to do that. So again, Dale, we're grateful that you've come to be with us this morning and to just be there to kind of give us a little bit of friendly advice on how we continue to work the relationships, even though we may not be able to do it the way that we have. We should still be working those relationships with ourselves, with each other, and in that faith perspective, I'll also say, obviously, for all of us, God. Okay?
Yes.
So thanks for being with us. Thanks for being the reminder of some of those things. We're going to be right back, everybody, after this Mercy Minute. So don't go away.
Lung cancer is the leading cause of cancer deaths in the U.S., and now we have an effective tool to screen for it. A low-dose CT uses a lower amount of radiation than a standard chest CT.
Breathe in.
Better detailed pictures than a chest x-ray of small abnormal areas of the lung. A person must be between 55 to 77 years old, asymptomatic, which means they don't have any symptoms such as coughing up blood, chronic cough, shortness of breath, unusual weight loss, or any other worrisome symptoms. They must also be a current smoker or have quit within the past 15 years, also must have a 30-pack year history or more, which equates to smoking 1 pack a day for 30 years, or 2 packs a day for 15 years. People generally avoid these scans possibly due to fear of what could be found. Like many other cancers, if we can detect lung cancer early, it could be very treatable and life-saving.
Well, again, thanks for choosing to spend some of your Sunday morning with us here at Faith in Our Hometown. I am grateful to all of you for encouraging us to get back on the air after our hiatus at the beginning of the time of plague during this pandemic. Again, we do need to take care of each other, and our guest this morning was very clear about that. We may have to do things a little bit differently, but we don't have to give up all the good things that are necessary for our relating to each other as human beings. We got to take care of each other. We got to take care of ourselves. We got to do those things. And if we continue to do those things, like all these other things I keep saying to everybody all the way through this whole thing, we're going to get through this. Not without a few bumps and bruises, but we're going to get through it. And we just have to be patient with ourselves and with each other so that when we get through on the other side of this thing, we can happily say together, look what we accomplished together as people, in our area. And this is how we did it, and we did it well here in our time. Okay? So God bless. I hope that you have a great week. Come back and see us again next week here for Faith in Our Hometown. God bless you and all those you love, and we'll see you soon.
Thanks for watching. Faith in Our Hometown can be seen Sunday mornings at 6:30 and 9 a.m. on KSN. Brought to you as a community service and sponsored by Mercy Hospital, Joplin.